There was a time when walking into a pharmacy meant shelves of mysterious brown bottles, a bell on the counter, and a pharmacist in a white coat who looked like he could also moonlight as a Victorian chemist or your high school biology teacher. You didn't just walk in for shampoo or energy drinks. You came for handcrafted potions, handwritten labels, and maybe a few leeches if things were really going south. But today, pharmacies are practically mini malls. You can get your flu shot, pick up a latte, buy laundry detergent, refill your birth control, and grab Halloween candy all in the same 10-minute errand. Welcome to modern pharmacy. Streamlined, digitalized, and very, very different from the days of mortar and pestle. So let's rewind a little. In this video, we're taking a journey through time to explore how pharmacies have changed over the years, from dusty apothecaries and neighborhood staples to today's fast-paced healthcare hubs. Because if you think pharmacists just count pills and slap labels, you're about to have your expectations recalibrated. Let's start with the basics. The word pharmacy comes from the Greek word pharmakon, which means both remedy and poison, which honestly feels about right. Because pharmacy has always been about balance, between harm and healing, between too much and just enough, between mixing up cures and knowing when to say, yeah, that's not safe for human consumption. In the early days, pharmacy and medicine weren't really separate. You had apothecaries, the original compounding professionals, who mixed up herbal concoctions, tonics and poultices using ingredients like foxglove, opium, mercury, and who knows what else. You might come in for a cough and leave with a bottle of something that numbed your throat, your lungs, and most of your short-term memory. By the late 1800s, pharmacy began to shift from artisanal medicine towards something a little more regulated. We started to get laws, training programs, and the birth of the pharmacist as a true healthcare professional. But even then, most medications were still compounded on site. The pharmacist was part scientist, part artist, and part local gossip hub. They'd measure powders on balance scales, mix elixirs with alcohol and syrup, and hand you something that looked like it came out of a medieval lab, because it kind of did. Then came the early 20th century. Enter mass manufacturing. Instead of compounding everything by hand, medications started being produced in factories, standardized, dosed, labeled, and ready to ship. This was a major leap forward for safety and consistency. But it also started a slow but steady shift in the pharmacist's role, from creator to curator. The mid-1900s is where things get especially interesting. Pharmacists were still respected, but their job had quietly shifted to focus on dispensing. They didn't always counsel patients. In fact, until 1951, pharmacists in the US couldn't even legally tell patients what their prescription was for. The doctor knew. The pharmacist knew. But the patient? Not always. Let's just take a moment to appreciate how far we've come from. Here's your mystery medicine. Take it twice a day and don't ask questions. By the 1970s and 80s, pharmacy education and practice began evolving again. Big time. We saw a push toward clinical pharmacy, a model where pharmacists weren't just pill dispensers, but actual healthcare providers, trained in pharmacology, therapeutics, and patient counseling. This is when the tide started to turn. Pharmacies began offering more direct services. Counseling became standard. The pharmacist moved out from behind the glass and into a more collaborative role with patients and doctors. And here's something I saw firsthand when I worked in retail pharmacy as a technician. People would come in all the time, not just to pick up meds, but to ask the pharmacist about everything from rashes to reflux. Hey, what do you think this is? Is there anything I can take for it over the counter? And the pharmacist? He loved it. He lived for those questions. You could see his face light up the moment someone asked something clinical. It was a reminder that people still trusted their pharmacist, not just as a dispenser, but as a real healthcare provider, a first stop for answers. Then came the chain stores. Walgreens, CVS, Rite Aid, and others reshaped the physical and business landscape of pharmacy. Convenience was the name of the game. Get your meds while you shop for batteries and greeting cards. There was a lot of upside here: extended hours, wider availability, and drive-thrus. But it also brought new challenges: more pressure, faster pace, and a perception that pharmacists were less healthcare provider and more retail worker. And let's not forget technology. The introduction of electronic prescribing, automated dispensing, and computerized drug interaction checkers radically changed pharmacy workflows. Gone are the days of reading chicken-scratch prescriptions written in what I can only assume was some ancient cryptic dialect. These days, your prescription zips electronically from your doctor's office to the pharmacy, where it can be verified, filled, and labeled without a single pen touching paper. But while tech has made things safer and more efficient, it's also added layers of bureaucracy. Prior authorizations, insurance rejections, real-time benefit checks. Now, pharmacists don't just verify the medication, they often spend just as much time fighting the system to get patients the meds they actually need. So yeah, it's less mixing potions and more coding rejections and calling insurance reps. And then came the pandemic. Suddenly, pharmacists were on the front lines, not just as dispensers, but as vaccinators, educators, therapists, and public health lifelines. You probably got your COVID-19 vaccine at a pharmacy, maybe even your booster. You definitely saw pharmacists showing up in news clips, helping their communities stay afloat. And for a brief shining moment, people remembered, oh right, pharmacists are healthcare professionals. And that's the biggest shift of all. Because today's pharmacist isn't just someone who fills your bottle and asks if you have any questions. They're medication experts, chronic disease managers, immunizers, smoking cessation coaches, birth control providers in some states, and often the most accessible healthcare professional you can talk to without an appointment, a copay, or a 45-minute wait in a paper gown. We've come a long way from the apothecaries stirring mystery syrups with a wooden spoon. Pharmacies have transformed from artisanal labs to mass-market hubs to highly integrated health access points. And while there are definitely still challenges, staffing shortages, burnout, corporate pressure, and an over-reliance on metrics that don't always reflect patient care, the core mission remains the same: help people get healthier, safer, and smarter about their medications. So next time you walk into a pharmacy, take a second look. Behind that counter isn't just someone counting pills. It's someone trained to prevent medication errors, answer complex health questions, spot dangerous drug interactions, catch red flags, manage vaccines, help with chronic diseases, and sometimes, let's be honest, run the entire store during flu season while still printing your photos. Pharmacy has changed. It had to, and it will keep changing. But the role of the pharmacist, that's never been more relevant. And here's the part we don't talk about enough: the relationship, the human part. Pharmacists don't just fill prescriptions, they remember your name. They know your meds. They catch things you didn't notice, and they explain things your doctor might have rushed through. They're the ones who step in when your insurance denies coverage, when your dose looks off, or when your medication list raises a red flag. That kind of quiet, behind-the-scenes care, it saves lives. Thanks for watching. If you enjoyed this journey through the evolution of pharmacy, hit that like button. Subscribe for more myth-busting, pharmacist-informed health content every Friday at 5 p.m. MST, and drop a comment below. Have you noticed how your pharmacy has changed over the years? Or maybe you remember the smell of those old apothecary jars. Either way, I'd love to hear your story. Until next time, stay curious, stay healthy, and maybe thank your pharmacist next time they save you from a prescription error, an insurance maze, or a sinus infection during a staff shortage.